Would I be able to open the blanket quickly? Just gonna put up the blanket. I can see your right legs are same color as the left leg, which is normal. And can I just touch your right legs? I'm just gonna pinch your foot. Do you have a feeling while I'm touching? I already document everything we did together, and I'll make sure to report to the RN, and we're just gonna double check it, and we'll get back to you how it was and how it's going to be. So we are all done. Thanks for your time and cooperation. Is there any questions today? If you were my assessor, would you pass me? And how would you rate 1 to 100? Thank you. 안녕하세요. 좋은 아침입니다. 저는 오늘 1시 15분에 스킬 어세스먼트가 또 예정이 되어 있어서 열심히 아침밥을 먹고 예정된 시간까지 PSA 연습을 하려고요. 잠옷으로는 연습이 잘 안 되니 옷을 먼저 갈아입어야겠어요. 짠! 모든 준비를 끝냈어요. 요즘 이렇게 간단하게 장을 하는 걸 즐기고 있습니다. 약간 머리를 잘랐어요. 그러면은 CSA를 연습을 해보러 갈게요. 오늘은 2가지의 CSA가 진행이 될 예정이고, 저는 챗GPT 정말 잘 쓰고 있거든요. 실무 과제 같은 거 있을 때 제가 어떻게 진행할 건지, 그리고 평가 기준은 어떻게 되는지 그런 정보들을 챗GPT에 넣어주면은 얘가 그거를 다 입력을 한 다음에 과제 그 실무 평가하는 거에 도움을 많이 주거든요. Hi.
Hey there, ready to jump into a bit of practice, or do you need any more tips before we start?
This is Joy. I'm a student at Murness. I'm looking after you today.
Oh, hi, Joy. Just my shoulder hurts. I feel a bit useless today. Everything just feels a bit overwhelming.
I'm really sorry that you feel that way. I try to find the best way you feel make it better.
Right, first question. Can you briefly explain the pathophysiology of osteoarthritis and how it might affect daily activities?
Osteoarthritis osteoarthritis means that the cartilage between the joints are broken down. So it gives the pain due to having that chronic condition. They might have felt the pain from the shoulder, and then it affects that she can't do the activities of daily living, or she having like some depression as well.
Great explanation. You covered the main points really well. Osteoarthritis involves that breakdown of cartilage, which can lead to pain and stiffness, and that can definitely impact.
Could you rate my things so far now from 1 to 10? If you were assessor, would you pass me?
I think you're doing a fantastic job. I'd give you a solid 9 out of 10. You were really empathetic. Your communication was warm and clear, and you showed a great understanding of the scenario. If I were your assessor, I would definitely pass you.
Tomorrow, my clinical skill assessment is for one of the unit about law. Hello? No. Hi, you there?
Yes, I'm here.
Yeah, it's nice to see you again too. So my name is Joy. I'm a student at Murness. I'm looking after you today afternoon.
I'm glad to have you here.
I know you just had a surgery and you just come back to the room. So I'm just gonna double check everything is going okay. But before I start here, I just want to confirm that your full name and date of birth. Thank you. And can I check your UR number on your wristband, please? And do you have any allergy before we start your care plan? And I realized that we didn't put your bed raise up yet. You don't mind me to put it up now, or how do you feel? The reason we are trying to put it on is because you might have fallen down, just in case, because we all want you to be a safe environment. If you feel that way, it's okay. You have absolutely right to refuse it. What if I just put the bed down? How about that? And then I'll try to make sure that you have a call back. Whenever you are trying to go out, just call us. We are helping you to go somewhere you want to go, because you just finished your surgery, so you might have dizziness or other symptoms. So we are always here for your help. Is there any question or is there any concerns that you are having it now? I think the previous nurses has forgotten to put it into the drugs room. I really apologize about that. Do you have any symptoms or any unwell feeling? Did you take it? Sorry, I'm really glad that you didn't take it today from our fault. But I'll try to make sure coming back every half an hour. And if you have any symptoms or any uncomfortable feeling, just let us know. Let the nurses know, and then we can double check it again. and sorry about that. And I will document this incident and then just make sure that we are going the right way, and I'll get back to you after that. So how I balance with her safety and her rights. So I would like to suggest the bad race first with the like a good benefits, like why we are doing that, explaining why doing this. Ask her preference, how does she feel, how does she like to do. If she like to refuse it, I'll just explain, yeah, you're fine, you have right to refuse it, I'm okay with it, just thanks for sharing your feeling and thoughts. And I'll suggest about another alternatives like moving back down or giving the call back and giving some education, like for example, you want to go move out, just call us so we can help out of you. You know, like that really helped me to speak in the scenario. Even though it's not the right scenario for the CSA, I can still like know what's going on, what I need to do, how I need to speak, so it makes more sense to prepare myself in the CSA. 오늘도 CSA가 있어요. 그래서 지금 9시고 전 오늘 11시 반 예정이라 마지막으로 한번 준비를 해보고 이제 랩으로 가려고요. 오늘 하는 거는 오픈 디스클로저 관련된 거여가지고 So I'm just gonna put some blanket out and put the warm hot towel. But would you like to check it, the warmness? If that is too cold, if that is too hot, I can put it a bit later. Thank you. So I put the towels on your body and grab another flannel and let him know I'm just gonna wash your face, your eyes, your nose, your lips, your cheek, your back of the ears, near the neck. How do you feel? And I dried his face and start washing his body from the chest part. So just nicely and gently wash, like rubbing his body with the hot towel. And at the same time, another my partner start dried out from the chest as well. So we'll keep going down, and just before the genital, just bring another flannel and then shim the genital part. Going to the toes, and then afterward just let him know we're gonna clean your back as well. So could you bend your arm to the shoulder, and then could you bend your knee to the left side as well, and we'll roll over to the other side. Okay, 1 2 3, thank you. And we're gonna clean your back. So we clean his back onto posterior part and then dried out, and we tried to change the bed sheet together because of the hot sponge towel bed bars. The bed sheet's gonna be wet as well. Importantly, during the shower we just check every skin thoroughly if there is any like pressure injury, any redness, bruise. Yeah, just keep observing during that. So after bath, clean everywhere. Is there anything you feel uncomfortable or you wanna like a dry or wash a bit more? Okay, then we're just gonna roll you back down. Okay, 1 2 3. We change his clothes to his basic clothes, all the gown as well, and it's all done. And afterward, because we already finished the checking the pressure injuries, there is some pressure injury we documented and report to the RN. And I'll try, because he's laid down at the moment, close, so we can start the active and passive exercise. Thanks for helping me in bar, and then we're gonna do some exercise with you. Would that be okay? So we are using some muscles and then like some movements together to make like more nice circulation to your body. So firstly, could you raise your right arm? Is there any pain with you?